Understanding the mechanism of action of FIRDAPSE. Control of muscle movement depends on input from the nervous system. The neuromuscular junction is the main site of this coordinated activity, relaying action potential signals from motor neurons to muscle fibers. Normal neuromuscular functioning requires appropriate transmission of acetylcholine at neuromuscular junctions. When an action potential reaches the axon terminal of the presynaptic motor neuron, acetylcholine is released into the neuromuscular junction. Acetylcholine binds to and activates acetylcholine receptors on the postsynaptic muscle fiber. Sufficient acetylcholine signaling initiates a sequence of events that results in muscle contraction. The action potential-mediated release of acetylcholine relies on the coordinated action of voltage-gated calcium channels and voltage-gated potassium channels. During normal neuromuscular transmission, an action potential causes a wave of depolarization as it travels down the presynaptic motor neuron. Presynaptic voltage-gated calcium channels open in response to the depolarization, allowing an influx of calcium. Increased intracellular calcium signals vesicles to fuse with the presynaptic membrane and release acetylcholine across the neuromuscular junction. Significant depolarization causes voltage-gated potassium channels to open and efflux potassium, repolarizing the presynaptic neuron. Repolarization leads to the closure of voltage-gated calcium channels, ultimately terminating the action potential and preventing further acetylcholine release until the next action potential. Patients with Lambert-Eaton myasthenic syndrome, or LEMS, have reduced neuromuscular signaling due to the presence of autoantibodies directed against voltage-gated calcium channels in the presynaptic motor neuron. These autoantibodies impair calcium influx during an action potential. Reduced intracellular calcium limits presynaptic vesicle fusion and release of acetylcholine across the neuromuscular junction. However, presynaptic stores of acetylcholine and the postsynaptic response to acetylcholine remain intact. Disrupted acetylcholine transmission reduces activation of acetylcholine receptors on the muscle fiber. Patients with LEMS experience diminished muscle fiber contraction and muscle weakness due to reduced acetylcholine transmission. Neuronal repolarization due to potassium efflux occurs as normal, ending the action potential before sufficient acetylcholine has been released. FIRDAPSE is a potassium channel blocker indicated for the treatment of Lambert-Eaton myasthenic syndrome, or LEMS, in adults and pediatric patients 6 years of age and older. FIRDAPSE is contraindicated in patients with a history of seizures or hypersensitivity to amifampridine phosphate or another aminopyridine. FIRDAPSE leads to an increase in acetylcholine release by targeting the source of neuromuscular dysfunction in LEMS, the presynaptic motor neuron. FIRDAPSE specifically blocks voltage-gated potassium channels, reducing the efflux of potassium. Blocking the efflux of potassium prolongs presynaptic depolarization, in turn increasing the influx of calcium and allowing for more vesicle fusion and acetylcholine release across the neuromuscular junction. Increased acetylcholine signaling helps restore muscle contraction and muscle strength. Important safety information. Contraindications. FIRDAPSE is contraindicated in patients with a history of seizures, hypersensitivity to amifampridine phosphate or another aminopyridine. Warnings and precautions. Seizures. FIRDAPSE can cause seizures. Consider discontinuation or dose reduction of FIRDAPSE in patients who have a seizure while on treatment. Hypersensitivity. If a hypersensitivity reaction such as anaphylaxis occurs, FIRDAPSE should be discontinued and appropriate therapy initiated. Adverse reactions. The most common, greater than 10%, adverse reactions are paresthesia, upper respiratory tract infection, abdominal pain, nausea, diarrhea, headache, elevated liver enzymes, back pain, hypertension, and muscle spasms. Please see full prescribing information at www.firdapsehcp.com. To report suspected adverse reactions, contact Catalyst Pharmaceuticals at 1-844-347-3277, 1-844-FIRDAPSE, or FDA at 1-800-FDA-1088, or www.fda.gov/medwatch. Learn more at firdapsehcp.com.